This special edition of the Open Soul Podcast was produced by students who participated in our podcast guest training program in October 2024. I'm Michael Riley, host of the Open Soul Podcast. Most of the people whose voices you're hearing today on this special episode had little to no experience doing podcast interviews less than a month before we did these recordings. The in-person training we offer prepares you to become an interesting and engaging guest on any podcast, where you'll be able to inform, entertain, and self-promote after just a few sessions. If you'd like to find out how you can attend one of our podcast guest workshops in the Phoenix area, please contact us by email at opensoulpodcast@gmail.com.
This is the Open Soul Podcast.
Good morning, good evening, good afternoon. This is Naz coming at you with the next segment of our very special edition of Open Soul Podcast. And today I'm joined by Donna Combs. Donna is a practitioner of Asian medicine as well as a color light therapist. Donna, welcome to the show. How are you?
Well, very well, Naz. Thank you for having me today.
That's great. Now, first, I'd just like to ask you a few questions about yourself. I'd like to ask you where you live, what are your passions, what makes your heart happy, let the people know.
Wow. So I live in Sun City, Arizona. My passions, Oriental medicine, walking my dog, quilting, fun things. So what makes me happy is doing the Asian medicine, treating patients. It excites me.
And how did you first become interested in what it is you do?
I was guided to do this. I was praying about this, meditating, and all of a sudden I needed to study Asian medicine. So I went and found a school in Hawaii. I was guided to go to Hawaii. And I went there and never wanted to visit Hawaii, never wanted to live there, but yet I went. And that was an experience of a lifetime. I started school there, and just so happened that my teachers, most of them were Taoist. So I learned how to do Oriental medicine or Asian medicine, the Taoist approach, and that's working with energy. I had one teacher that took me aside and said, I don't want you measuring for points anymore, finding your acupuncture points. You see them, and I want you to treat patients by what you see in their body, not by what the book says. You still have to read the book and know how to take the exams, but this is how I want you to treat. So they encouraged me to do that.
Would you say that's a unique approach to how you do this?
Yes. After I was there a year and a half, I was guided to go to Santa Fe, New Mexico, to a school there, and that's where I graduated from. But at that school, they were training us as doctors. This was before there were any doctors of Oriental medicine. That's how we were being trained. We had to know Western and Eastern medicine. So I've had that background along with working with the energy.
And so you've mentioned a couple times now that you were guided to do this. Would you say that means that you have somewhat of a heightened intuition?
Very much so, because when I'm treating patients, I look at their energy, and that's how I'm guided. Their body tells me what they need. And what we don't understand is how intuitive and intelligent the body is. Your body will tell you what you need and when you need it. So as I read a person's energy, I learn that, well, if I do this one point, whether it's using laser or using a needle, as soon as I put in one point, then I'm look at their body to see, well, what else is lighting up? Where do I need to go next? And so their body, sometimes I may only use 4 needles, and they get the most amazing results from it. But that's because I listened and paid attention to what their body said.
How long have you been studying this as a healing modality?
Over 20 years.
Over 20 years, so you're very experienced.
Yes.
Now, I'd like to ask you, what are some of the things that Asian medicine includes?
Well, it includes acupuncture, tuina, which is a Chinese massage, herbs. It also includes gua sha, which is a scraping of the skin to release any energy, actually heat from the body, or cupping. So those are the different modalities it offers.
And now I've heard that there is a little bit of a stigma when it comes to acupuncture. Some people might be afraid of it because it might be, some people might perceive it as invasive. What would you say is a common misconception when it comes to acupuncture?
Well, people think that acupuncture, it works with needles. And now in this new day and age, we're using laser, a lot more laser that is non-invasive. And so I tell people, look, if you want needles, I do needles, but I'm gentle with them. I feel that if I put a needle in and you feel pain, it's putting trauma upon trauma. Therefore, you're not going to get the benefit of the treatment.
Without mentioning any names or breaking any HIPAA laws, I would like to ask you about a story, just an example of how you've seen color medicine benefiting a client that outweighs the benefits of acupuncture.
Okay. Well, after doing acupuncture for several years, I started working with color, and I became internationally certified in esogetic color puncture, which is using color lights on acupuncture points. So I have had a patient that I treated with acupuncture, and then after the treatment, she had scoliosis of the spine, severe scoliosis. She had her lower rib setting on her pelvic bone, so her spine was very crooked. So after treating her with acupuncture, I decided to do a treatment called unwrapping the spine. And as I was using that treatment, after I finished, I told her to go ahead and get dressed, and I walked out of the room. And when I went back into the room, she was standing straight. Her spine was now straight.
Wow.
It had been crooked. She had that problem for her whole life.
Now, that's incredible. So for those that are interested in pursuing that color medicine as a healing treatment, what would you say a typical session would look like? From the booking to the walking out the door, what is something that somebody could expect?
There's a consultation. I will talk to them, find out what they have going on, and then I would do a treatment on them, do a color puncture treatment. So in our classes, we were always taught that you had to do the color on the bare skin. And just recently, I treated a patient that had her hips were one was higher than the other, and I did this unwrapping the spine through her clothing. When she got up, her hips were even.
Wow.
So I go, okay, this can be done even through clothing.
Through clothing. So it makes it even less invasive than needles, and it makes it super comfortable.
Yes.
Just yesterday, we were having a conversation, and you were sharing with me a powerful experience that you had when you were studying this in Hawaii. And I'd love for you to tell me again, because I think this showcases really well just how powerful you are as a healer.
Well, one of my teachers found that I could see the acupuncture points and see the energy. And so in one of our classes, well, actually it was in clinic, and our supervisor was on one side of the table, we're on the other side of the table as we're treating. So we have to follow his lead. And one of the things we were taught was to measure for the points. And he reaches across the patient, slaps my hand, and he says, if I ever see you measure for another point, you're in trouble because you see this. You see the points that need to be treated. And he says, that's how I want you to treat patients from here on out. So that was absolutely, it shocked me.
Yeah.
So we also had a class together in Tai Chi, and he would work with me every week and try to get me to push him across the room using my energy. And that's when I realized how powerful our energy is.
Absolutely.
So then when I was guided to go to Santa Fe to study, one of my clinic supervisors was an MD from China. And so I had treated a patient, and it was stomach 36. He walks in, he looks, and he says, that's not where stomach 36 is. And I said, yes, it is. It's not where the book says, but it's where her body says. And he goes, oh. And he backs away from the table, gets a smile on his face, and bows to me, turns around, walks out of the room, closes the door. Then the door opens, and he looks in, grinning from ear to ear and showing me 2 thumbs up.
That's huge.
And so from then on, I knew I was on the right track.
Wow. That's really incredible. I just love hearing that story. Now, you mentioned you studied in Hawaii. You also mentioned you studied in Santa Fe, New Mexico. Now, those are 2 vastly different climates. So I'm curious, when it comes to this healing modality, using Asian medicine, as well as color light therapy, and even acupuncture, I'm curious to know, how do the different climates that people live in affect the healing that they might receive?
Oh, that's a good question. I learned that after being in Santa Fe, it was like, wait a minute, people coming in with back pain, they're got totally different symptoms than those in Hawaii. So I found that in Hawaii, we're treating them for damp heat in the back. That's what most of their back pain was caused from. In Santa Fe, it was cold that was in their back. And then after I graduated, I was guided to go to Western North Carolina, and I had my practice there, and I was treating people there. And that's when I found out that in that area, it was damp heat in the back, which is a different type of pain. So I thought, well, this is interesting. Every different climate, people have different types of pain due to that environment. So then I was guided to moved back to Arizona, and that's when I had moved to Tucson. And there I was a clinic supervisor down there at the acupuncture school. And while I was there, I was treating patients, and I found their back pain was just due to heat. So it's a lot of inflammation. So in each area, you treated them differently.
That's incredible. And are there any resources that you might recommend for those who are aspiring to pursue this career themselves?
You know, there's a lot of resources out there for Asian medicine or acupuncture, but with esogetic color puncture, one of the books I recently came across was called Color Me Healing by Jack Olenak, and he tells all about it and how it was created, and it was amazing. It just was a great book. And I kind of wished I had read that before I even became internationally certified. It made so much more sense.
Right. Donna, what motivates you to keep doing what you do?
It is hearing a patient say, "Thank you for giving me my life back."
Wow.
I treated several years ago a veteran. He came in, he had knee pain. And when I was treating him, and he says, "The VA can't find anything wrong with my knees. They've done everything, and they can't find anything wrong." And he says, "But I can't walk. I can barely walk. I can barely climb the stairs." And he says, "I have to go up 4 flights of stairs a day." And he says, "I've been having nightmares." And I says, "Do you mind telling me what your nightmare's about?" And he told me, and I said, "Okay, the next time you have this nightmare, if you are cognizant of it, I would like you to ask your buddy in the nightmare why he keeps appearing." So I didn't see him for a month. He came in a month later, and he comes in, hugs me, and he says, "Thank you very much. You gave me my life back."
Wow.
He says, "I am now running up 4 flights of stairs a day, and I'm training for a 5K marathon with my daughter."
Wow.
And I said, "What changed?" And he said, "Well, I had that nightmare." And I asked my buddy, why do you keep coming back to me? Why do you keep doing this?" And he says, "Because I wanted you to know. Stop feeling guilty, because this is the way I was to leave this world. You were to stay here, have your family, and enjoy life and experience it to the maximum." So he says that changed his life. And then he told me that he would go, when he went to the VA, he would sit there in the waiting room and tell other vets what he went through, and they started experiencing the same thing. And he said to me one day, he says, "Look at all the people you've helped." I said, "No, I helped you. You're the one who helped them."
Donna, that is such a powerful experience. You are so powerful. You are also a frequent flyer at the Place of Spiritual Wisdom. Now, for fellow attendees, as well as our listeners who are curious, how can people get in touch with you if they want to know more about your work?
They can contact me through the Place of Spiritual Wisdom. Barbara will have my cards, and they can ask for my phone number and get in touch with me through that way.
Great. Donna, it has been such a pleasure speaking with you. I'd like to thank our listeners at this time for tuning in to this next segment of our special edition of the Open Soul Podcast. And Donna, I wish you all the best. Thank you so much.
Thank you very much, Naz. It's been a pleasure.
You're listening to the Open Soul Podcast.